Transfers in and out of wheelchairs are one of the more frequent ways people with spinal cord injuries fall. Transfers out of manual wheelchairs are challenging because the chair tends to have a shorter wheelbase and people have to move their weight forward to clear the rear wheel. This significantly changes the center of gravity and balance of the wheelchair, putting patients at risk for falls. The key to a safe transfer is keeping the patient's center of gravity within the base of the wheelchair until the patient's center of gravity can be supported by the transferring surface.
Transferring between a manual wheelchair to a bed and transferring from a power chair to a bed are slightly different. The power chair is heavier, it's narrower, and that allows you to get closer to the surface that you're transferring onto. Also, because the wheels are below the seat rather than either side of the seat, you don't have to transfer over wheels. A manual chair has the wheels at the side of this seat that you're sitting on, which makes it wider and provides an obstacle that you have to be able to transfer over in order to get to your destination. And because it's lighter, it's more prone to tipping if your wheels aren't in the right place, you haven't got your centre of gravity sorted out.
Moving forward puts more weight on the front casters and less on the rear wheels. However, sometimes the weight shift can be too great, and if the center of gravity moves in front of the caster, the chair will tip and the patient will fall forwards. Placing the feet on the floor will eliminate any tendency for the chair to tip forwards.
When somebody's transferring from a manual wheelchair onto a surface at the same level, before you get there and start the transfer, think about how it's going to be done. So if they've got short legs, they're not going to be able to get the feet down to the ground to be able to use the ground as the base that they're standing on. They're going to be transferring weight forwards onto the casters.
By locking the casters forward, we ensure a long base of support and also stop the front of the chair from moving when the patient transfers. This enables the patient to safely put lots of weight on the footrests without the chair tipping forward, and also apply lots of force to the outside front corner of his chair to perform the transfer. Always ensure that the wheel locks are on and tires are sufficiently inflated. If possible, place feet on the ground before initiating the transfer. If placing feet on the ground is not possible, ensure that the front casters are in a forward position. If caster locks are available, lock the caster wheel to prevent chair movement while transferring. If a caster lock is not available, placing a foot to block movement of the caster wheel will ensure that the wheelchair will not move.